Hello team, my name is Annette von Dregalski. I'm the director of the Hemophilia and Thrombosis Treatment Center at the University of California, San Diego. I'm a hematologist by training, and this is Peter Aguero. He's a doctor of PT or physical therapy. We both tag team and work as a team to bring point of care musculoskeletal ultrasound to our clinic, and we use it mostly for rapid and quick bleed detection. This is the focus today, and we start with Peter's ankle. There are only two positions that you need to detect the bleed, and gel is very important. And this is in short axis, the tibio-talar joint space. Peter, would you mind freezing? And Peter will explain to you now what's to see and what a bleed would look like.
So here we have the bony cortex of the talus. So we're looking at the cross section of the talar dome here. That's that white, bright, hyperechoic line that's there. You want to see it nice and bright and crisp. On top of that, we see a black strip lining the bone, which is the cartilage on top of the talar dome. And then right above the cartilage is where you would see an effusion. So in my ankle, you can see this kind of tissue, mixed echogenicity tissue that's within the joint capsule. And we know it's within the joint capsule because it is below the dorsalis pedis, which is here, which is this artery right here. So everything below this artery, all the way down to the cartilage, is considered still within the joint capsule. So you would then see an effusion that's sitting right on top, and it would look dark, hypoechoic with speckles inside, and compressibility when you do some sonopalpation and press your probe into the skin.
In essence, the bleed would replace move the joint capsule upward and would fill the joint space. Good. So now the tip-tail joint space, but in long axis. This is all you need. See my probe position on the joint in long axis. Oops. So now we're going to the second position necessary for joint bleed or useful for joint bleed detection, and that is the tibio-talar joint space in long axis. And we will freeze the image here, and Peter will explain.
So here now we're looking at the tibio-talar joint space in long axis. Again, we can see the talar dome in that dome-like form right here, in that bright white echogenicity of the bony cortex. We see that same cartilage on top of the bone. Then on the left-hand side, we see the tibia, the distal end of the tibia, coming down and meeting with the tibia, with the talus and the talar dome. So in between here is we have the joint space. Again, we see the dorsalis pedis, or catching a little bit of the dorsalis pedis in longitudinal axis here. So everything below the dorsalis pedis here is considered still within the joint capsule. We see all of this mixed echogenicity tissue again within the joint capsule. And so if you were to have a hemarthrosis in this patient, this effusion would then spill out into this area and occupy this area above the cartilage, above the talar dome. Then it would then push this tissue that's sitting here inside of the joint capsule superficially, and you would then see this kind of bridge-like tissue or joint capsule that's kind of suspended down in a concave form. It would then be convex. It would kind of wrap up like this and gonna get pushed superficially.
And we have a little incidental finding here in the talar navicular joint space of Peter's. You can see some fluid, and let's just explore this a little bit. I'm going back into the area and trying to compress, and I think you can appreciate, Peter, maybe you can direct that little arrow or hand to the space, that it is compressible. So this is what fluid pockets look like, or what effusions look like. It's relatively black and echoic, so therefore probably some kind of serous effusion. Peter, did you know that?
I exercised this morning, so that makes sense.
There you go. Thank you. So we now proceed to the knee.